just to kind of give a little bit of how this went, opening a clinic, it's not an easy thing. It's not impossible, because if it was, I wouldn't be doing it. And there wouldn't be other professionals doing it as well. But starting your own clinic, it can be rewarding, can be challenging. And there's so many different levels and layers to it, ups and downs, like any other business. But for me, I wouldn't see it any other way. Thought about the opposite end of going to get a position at another company as a nurse practitioner, but then I found that I know I wouldn't be satisfied. So still in the fight, I'm still in the journey. I've only been open. This is my second year. So we're still working through things, still building, still learning a whole lot, having to learn the business side, which you hear a lot. If you're a nurse, you have heard this, that in medical professionals don't learn business, and it's true, but it doesn't mean that it's impossible for us to learn it. We just have to, what I always say, be led by questions. So when you have a question about something that you don't understand or don't know, go and find the answer, whether it be through someone else or by reading, doing the research, and reading and making things make sense to you. And then being able to apply those things to your practice, whether you choose to or not, right? Let's see. So basically, the first step for me was basically deciding what type of clinic or what kind of clinic I wanted to create. So for me, it's primary care, focusing on preventative care. We do chronic care management. I see all ages, because I am a family nurse practitioner. So all ages are welcome, from birth to end of life. But I do have a side that is focused more on chronic care management, with hypertension, diabetes, and obesity being the main focuses on that end, outside of the normal preventative care. So when you think about it, the preventative care side allows me to assess patients on a regular basis. And then when we see things that are like your blood pressure or A1C that are trending upward, or your weight that is trending upward, then we kind of can look at more chronic care management, to a little bridge between chronic care and preventative care. So we don't want you to cross over to chronic care, because that means that this disorder has been there for 6 months or longer. And so we're monitoring you in preventative care to catch these things early and hopefully prevent them from crossing over into a chronic care need. But if you are already there at the time that you are a new member or a new patient to us, then we can focus more on the chronic care management. And I'm setting up programs for hypertension, diabetes, and obesity, which then we can tailor them to the individual needs, to help manage and hopefully reverse those things that are causing the trouble. So basically, going back into the business side of it, the first step was basically deciding what kind of clinic I wanted to open, right? Then we do the research. So you need to look at the areas, if there's any gaps in primary care, and then what things in that area people may be suffering with, and that helps to dictate what types of services you may want to offer. Let's see. Then you're going to look at, of course, your business plan, looking at your mission, your goals, projections, then your service model, which all comes from that research that you've done to see if there's a need and what the need is. We talked about the licensing, and I'm looking kind of at my notes a little bit just to make sure that I'm not missing. It's not all in order, but these are the things within this past 2 years that I've been looking at. And you continuously look over these things. Like I said, it's an up and down battle with learning, right? And so you had your licensing, North Carolina Board of Nursing, Secretary of State. Then you go into your bank account for the business. You go into, let's see, EIN, of course, for your tax purposes. You need to understand either getting you a CPA, or I agree with having both, with learning on your own and then also finding a medical CPA to help you keep track of those things. But I think you should always understand your taxes and things of that nature as well. So maybe, doing them and then turn them in, let them check over them and do their part. That may be an option. Or if you're confident in it, you can do them yourself until you decide to hand it over to a CPA to let them manage your taxes or finances, that area. Let's see. Next one, another major part after setting up the basic business parts is your credentialing with insurance companies. So for me, we do insurance, Medicaid, Medicare. We're doing direct primary care membership and just your normal self-pay. At this time, we'll see how that goes. But at this time, those are the sources that we're using for our members, as well as some other referral contracts that we are working with for our revenue. So credentialing is not, it's not that hard. You could do it yourself, or if you don't want to be bothered with it, you can hire a company. There will be plenty of companies that will contact you probably on a daily basis, no matter how long you're in business, to see if they can help you with your credentialing and billing. So you can always hire someone to do that for you. For me, it was more economical that because in the beginning you're not seeing that many patients, so you should be able, well, I'm not going to say you should be able to, I am able to keep up with doing the credentialing, contacting the insurance companies when I need to, and doing my own billing at this point. Now, maybe later, I think once it picks up and there's a lot more patients, a lot more billing and credentialing, and then you have the issues with the billing and that need to be addressed and all that, may look into hiring someone to handle those things, because that may be too much to be a provider, business owner, and do all the billing and all of that stuff. There's only so many hours in a day, right? So that's a big thing with choosing which insurance companies you would like to work with based on your area. What are some of the main ones that that the members in your area may have, and then you choose from there what you want to use or don't use, and try to seek contracts with them, or getting in network. Those are the things with your credentialing. And you're looking at your equipment and supplies. This is where it comes into spending your money, right? In the beginning, you may have, maybe you have the money saved up to do a self-loan to your business that you will acquire back later once the business is making money. Or you could have a bank loan if that's the route that you choose to go. For me, I just chose to invest my own money, and then I also work in the business, so as a provider, so I'm able to obtain the furniture and supplies and things of that nature as I'm making money after the initial startup to have things that I needed to get. I haven't hired any staff because we are still very I would say, I guess you can say slow. A little bit slow as far as patient intake at the moment, because the first year we were in a different location, and we moved the second year. So it's almost like starting all over again. And so, it's still a little slow. We're getting there, but it'll be a little while, to build up. So it just takes time. And that's what I found so far. Unless you have a huge amount of money to invest in crazy marketing, it may be a little bit faster, but it's still based on the patient's needs. Do they want to switch from providers they have based on whatever plans they have, as far as their insurance and things of that nature? So getting your equipment, one thing I can say, it depends on you as the individual. If you would like to buy secondhand furniture that is in very good, has been very good care, has been taken care of it, or if you wanted to go the route of buying brand new, totally based on what your finances are set up, or how they're set up, how much you have, and things of that nature. There are companies that you can basically, I guess, like rent to own the majority of the equipment, and then you pay as you go monthly. That wasn't my route. I just decided to get furniture and exam tables that were really good, in really good condition, and use those. I haven't had any issues with it as of yet, so it's working for me. Because those can get pretty expensive depending on the brands that you get. And one of the ones that I got was very expensive, and I got it for a really good deal, so couldn't pass that up. So you're looking at, then we're going to get along with this video because we're at like 14 minutes. So marketing, social media, kind of what I'm doing now. But this channel is more so just for other professionals, because I do want to push along and help to push along the nursing or nurse practitioner side of medicine, because I do believe in it. So just providing insight on things that are possible, basically, is what this channel is about, as well as education. So I will have some educational videos as well. So you can, let's see, some of the challenges. Let's talk about that quickly. One of the biggest challenges is networking with other professionals for guidance. Not really a outgoing type of person, so to say. So being able to find other healthcare professionals that are to network with. I know there's different groups you can get in. I still haven't managed to get that part worked out yet. So that's a big challenge, where you can find other people that you can bounce ideas off of. You all can network, whether you're in the same area or not. If you are, that would be great, especially if you are in different aspects of healthcare where you could refer patients to each other. That would be an awesome thing to find. It's something that I'm kind of working on, looking into a little bit more. But yeah, for the most part, that's like one of the biggest challenges. And then just marketing just takes time. You just keep doing what you're doing every day. Trying to do a little bit more to reach more people, let them know about the services that you have, that you're providing, the care that you're trying to provide to the area and to the community. And then wanting to grow faster than maybe you are than the area that you're already in. So that can be a challenge. So you want to, you have this great plan of how you're going to do things, and trying to make sure that you stay within realm to grow, but not faster than what you need to. So that can be a challenge. So let's see, to close this out, I'm not going to hold you any longer. If you have any questions or comments or questions about things that you may be thinking about that you would like to ask, I would be more than glad to help out. Just drop your question in the comment section. I will try my best to either make a video about it, because there may be someone else that has the same question, or we could chat about it as well. So my advice to you is, don't be afraid to start small. Build as you go and focus on providing excellent care, right? So that is something that I have to tell myself on a regular basis, because like I said, sometimes you want to grow faster than what you're able to at the moment. But just take it one day at a time. You'll get there, and then one day you'll look back and say, man, I've come a long way, right? So yeah. So if you found this video helpful, please like and share it with other healthcare professionals. Let me know in the comments if you'd like me to dive deeper into any of the specific parts of this process.